Hi, I'm Dr. Jeff Borenstein, the editor of Psychiatric News, and I'm here with former Congressman Patrick Kennedy. Patrick, welcome.
Thanks, Jeff.
So happy to speak with you. And I want to jump in and ask you about the status of Parity, which you were so important in terms of getting it involved and getting it passed.
Well, it was the highlight of my political career in Congress to be the author of the Mental Health Parity and Addiction Equity Act, and of course I did it with Jim Ramstad, my Republican co-sponsor, and my dad took the place of the late Paul Wellstone, who's our hero, always will be, and worked with Pete Domenici to pass that. In 2008, it's 5 years later, we still don't have the White House delivering the final rule, which will discuss scope of service. So the law passed that we need to treat mental health the same as all other physical health, but we don't know what that means. So of course, APA is lodging all kinds of class action lawsuits to define the law through its implementation. But ultimately, we need your members to show up at their state Board of Insurance and Exchange, which is trying to decide what does essential health benefits mean in mental health and addiction. So I look forward to working with you on that. As the author of the bill, I can correct all the insurance company lobbyists who will say it's something else, but I wrote the bill, I know what it says. It says that care has to be completely analogous. So if you cover diabetes, primary, secondary, tertiary care, inpatient, outpatient, in-network, out-of-network, pharmacy, and ER care, then you've got to do the same exactly on parity, on par, in terms of mental health. So we need to do this. It's only going to happen through the activism of your membership and consumers. And I'm a consumer of mental health, someone in recovery, thanks to mental health intervention. So this is an exciting time for mental health, and I'm looking forward to working with your members to try to see it implemented, because it's one thing to pass the law, but now we need to implement the law.
In many ways, it's a grassroots effort to make that happen.
And we're coming up on the 50th anniversary of my uncle, President Kennedy's signing of the Community Mental Health Services Act of 1963. So this October, we're going to mark that 50th anniversary by recommitting ourselves to the notion that people can be treated in their community. And of course, as you know, in the history of the last 50 years, the money never followed people from institutions to the community. So what ended up happening? People went back into institutions. Now they're in the institutions called jails and prisons, and also in our ERs.
More people are in jails than in psychiatric hospitals, unfortunately.
So the answer is we need to execute what John F. Kennedy said: prevention, community-based continuum of services, and we need to do better research in order to come up with better therapies and treatments to treat these illnesses. So it's an exciting time. Happy to be working with APA. Looking forward to working with your members across the country in their own states to see that mental health is incorporated in overall health. As we redesign what health care means in this country, let's make sure mental health is included.
Patrick, thank you for all that you've done and all that you're going to do moving forward.
Thank you, Jeff.
Thanks a lot.
Pleasure.
Take care.